There is plenty of debate around the government's plan to shake up Medicare. There are a lot of different ideas on what a modern Medicare system should look like. I mean, health funds are pushing to be able to cover doctors' gap fees, and there's talk of sharing the load of primary care between other health practitioners. There's a lot to digest, and to unpick it all is joining me now is Shadow Health Minister Anne Ruston. Anne, thank you for your time. Really appreciate it. The government's made some big announcements here, but a lot of people don't seem to really know what's going on. Help us through it.
Well, I mean, first of all, I think one of the track records of this government so far in the 8 months it's been in government is it's very good at making announcements, but everything seems to be lacking in detail. And what we've seen here with the announcements yesterday and leading up to yesterday are a whole heap of announcements without any detail to enable anybody to really analyse what they're proposing. But, since they've been in government, this government has talked a lot about the problems. We have some really significant challenges in our healthcare system. Nobody is denying that.
What are they?
Well, I mean, right now we're finding that less than 15% of our medical graduates are choosing to take on general practice, which means that we are in a downward spiral in terms of the number of GPs that are Australian trained, which means we're increasing our reliance on overseas trained doctors, which is an unsustainable situation going forward. So most of the things are actually pointing towards workforce, exacerbated through COVID. We've now got a huge backlog of deferred care because people weren't being screened and tested during COVID. So unfortunately, it's been a bit of a perfect storm brought on by COVID. But there are, the underlying reality of dealing with the challenges in our medical, healthcare, aged care and disability care sector at the moment are totally underpinned by workforce. And so far, we've had a job summit, and I have seen nothing come from the job summit that is going to alleviate our care workforce, our registered nurses, our doctors. And so I think that's what Australians are crying out for. They want some solutions to the real issues that are before them. They want more doctors, they want more nurses, they deserve more doctors, they deserve more nurses, and we need actions that are going to deliver that.
One of the great challenges I've seen as my children have grown into adulthood is a lot of their friends have wanted to study medicine. They've got excellent marks at school, they more than qualify on that basis, but they're prevented from doing medicine. It's almost like there's a closed shop. Is that a problem for some of our students or those who desire to get into the medical field, that entry is just too difficult?
Well, I think there's a couple of issues here. One is we want more doctors in country areas, so I think we do need to work out ways that we can get more country students being able to get access to medicine, because we know that if someone comes from the country and also if they train in the country, they're more likely to stay in rural and regional areas. So I think that's one issue. I also think that we need to make sure that that we are training as many Australian doctors as we possibly can. But the fundamental problem is that we're having a lot of people intakes into medicine, but when they make their decision at the end of their medical degree about what they're going to specialise in, so few people are choosing to do it into general practice or rural specialists. They're all deciding they want to be orthopaedic surgeons or gastroenterologists or paediatricians or the like. And so we're finding that at that point, halfway through their training, they're choosing to go somewhere apart from into primary care. A primary care system is the fundamental thing that underpins Australia's healthcare system. So that's the challenge we have. We must fix that now.
Yeah, one of the great challenges, of course, for your government when you were there, and you weren't the Health Minister, Greg Hunt was you were dealing with the pandemic. It seemed to occupy, all the time and energies of most of Australia. Does that mean there were some things that weren't done that perhaps should have been done and you think the government should be implementing now?
Well, I certainly think COVID gave us a hiatus of 2.5 years, and deferred care is the classic example. The people that haven't been screened and tested, the people that are presenting to the health system now with much more serious and further advanced conditions is a really significant challenge and should not be underestimated. But during COVID, we did what we had to do. We put in place the COVID measures to protect Australians, and tens of thousands of lives were saved, and we had a pretty strong economy. But there are consequences of that, and the consequences are now. And the challenges that, inevitably were going to come are before this government. They knew they were coming, we knew they were coming. But what we are crying out for and calling on the government is to stop talking about these issues and actually give us some real and tangible things that we can start doing so that Australians can regain confidence that their primary healthcare system is on the mend.
Yeah, I think that's what all Australians want. Change of pace. Now, this time of year, it's always discussion about Australia Day. Do you want to change the date? Do you want to keep the date? What will you be doing on Australia Day to celebrate? and either in a private or an official capacity?
Well, look, I love Australia Day. I think it gives us a wonderful opportunity to reflect on the journey that is Australia. It's an exciting journey. It's a diverse journey. Celebrate Indigenous Australians, multicultural Australia. But it's a time to reflect. I mean, not everything's been perfect in the past, but we can't deny that some of our history is perhaps as it wouldn't be now. But Australia Day is a day for all Australians to celebrate, and I just say to everybody, take the opportunity to reflect on the past, but to make sure that we look forward to a great future. And by celebrating on Australia Day, we have the opportunity, to set the agenda for the future for the rest of the year.
Yeah, it's the greatest country in the world, and I think a lot of Australians do want to celebrate everything that makes this country what it is today. And that's some good times and some not so good times as well. So
absolutely.
Brings us together. Senator Anne Ruston, thank you very much for your time tonight. Really appreciate it.
My pleasure.